Our goal is to just begin the conversation at a very high level because everybody's trying to figure out what these cuts will mean to us, including me and everyone here, I'm sure. We will supply the facts as we know them today. Most of what we discuss with our experts will be about the Medicaid cuts, which I think probably a lot of us in this room today, that is our number one concern. As the chair of the Michigan Legislative Disabilities Caucus and a member of the Attorney General's Elder Abuse Task Force, I really am very concerned about how Michigan is going to be impacted by these unconscionable Medicaid cuts, especially how they're going to hurt seniors and people with disabilities. And while the cuts are coming from Washington, just to kind of explain, they will mostly be administered here in the state of Michigan through Michigan's Department of Health and Human Services and at the local level by providers, such as the organizations that are represented here tonight. Our guests will help us begin to understand the sweeping changes that are coming. And first of all, I'm honored to be joined today by all of my special guests. First, they're going to give 3 to 4 minute introductions of themselves and what the updates that they can share with you about what's happening in our state legislature. First, Representative Natalie Price, one of my favorite colleagues in the State House.
Well, thank you all for joining us today, and thank you, Rep MacDonell, for organizing this amazing opportunity for us to get out and connect with our communities. So, as Rep MacDonell mentioned, you know, this horrible mega budget bill was signed into law on Friday. We expect there to be some pushback, fortunately, hopefully, from the federal judiciary, from the Supreme Court and others, saying that some of the cuts that are pending won't be able to go into effect. But we have to be prepared for the worst. We know our state budget, 70% of our Medicaid state budget relies on federal funds. 42% of our total state budget relies on federal funds. So what are we doing about it? Well, okay, I guess a little more ground setting. Nationwide, as we know, $12 million could lose their health coverage, and that's according to the Nonpartisan Congressional Budget Office. We know that a quarter of the people here in Michigan are on Medicaid. Upwards of 700,000 could lose their coverage under these pending cuts. And it's not about cutting spending, it's cutting health care to fund tax cuts for the richest Americans at a time when people are struggling to put food on the table or make their rent. These federal cuts, they can't just be replaced with state money. Programs will need to be cut and some will end. However, I can't just stand by and watch. What am I doing? I am raising awareness and asking you and my constituents to share their stories about how they will be impacted by the cuts. I am also modeling some legislation on what some other state legislators have been doing. I'm working with the States Project to get some legislation that would allow any federal cuts that are found to be illegal in federal court to be answered by Michigan withholding an equal amount of taxed money from the federal government, instead of passing it along, keeping it here to fund those essential services as they were designed. So that is some legislation that we've submitted to LSB, to our team of attorneys, to write up. And again, we're working with the States Project, trying to make it clear that we intend for our tax money to stay here in Michigan to keep essential services to protect our people as much as possible.
First of all, I am just amazed walking into this room a couple minutes early that this room was already packed and it's still getting even more full. Hopefully we won't violate any fire codes, but thank you all so much for being here. I think your presence really shows that people are paying attention to what's going on at the federal and state level, and I think that we are all worried. I'm worried about what's going to happen in our state. I'm worried about my children's future, what's going to happen with our neighbors, and I'm worried about the millions of Americans who are likely going to lose their health care coverage. I'm worried about people who are going to go hungry. It is 2025 and we're talking about taking away people's food and health care. And so it is honestly just inhumane, a lot of what is in the big terrible bill that was passed last week and signed by President Trump on Friday. And I know that we are all very aware of how dramatic these cuts will be. But I wanted to just highlight the Michigan Senate. Senator McMorrow and I are lucky to be part of a Senate Democratic majority where our chair of our Health Policy Committee and our chair of our State Appropriations DHHS Subcommittee really have been working on this issue and looking at it for a really long time. And they've been holding hearings and bringing experts to come testify, to talk about not just the numbers and about the services, but the real life stories of people whose lives are now literally in jeopardy. And so just a couple of things for you to note, if you didn't already know, a quarter of Michiganders are actually covered by Medicaid. And Medicaid patients make up 22% of the volume of hospital patients across the state. And we know, and I'm sure many of you are aware, right, there are certain hospitals in really rural settings or really urban settings that have an even higher percentage of Medicaid patients that are going to be in jeopardy of closing. And we've heard this directly from hospital administrators. This is not a fear-mongering situation. This is based on the numbers and the data and knowing, every year looking through the books and knowing what is the percentage of Medicaid patients that walk into that door. And so when people talk about these Medicaid cuts and what the impact will be, it's of course going to be on the folks who are directly losing their health care coverage, but it's also going to be on everyone else who relies on a working hospital system in their area. So it is terrifying, but I think that there's so much that we can do. I'll just quickly highlight a couple things that are in the Michigan Senate budget that we passed in May, which is the responsible time to pass a budget out of a chamber in the Michigan legislature. We actually included a grant program for food banks. Food banks are not going to solve all the problems, but they are very helpful and they really need our help. I just visited, I think last week, Gleaners, and a really exciting site that they are almost ready to open at the corner, basically at the 8-mile border between Warren and Detroit. And they're really struggling, and I know that they are not alone. We know that food banks across the whole state and country. We also have some grants in the budget around for nonprofits who are struggling, and we hear every single day, multiple times a day, from nonprofits who are facing federal cuts, as well as from our small businesses who are also really struggling. And so there's much more to share, and you'll hear more later on.
I'm State Senator Mallory McMorrow. The fact that you're all here tonight shows that this is an issue that deeply impacts everybody across the state. I know that my colleagues and I wish that we did not have to have this meeting. We did not wish that we saw this bill come down. We know that what's happening right now is there's a lot of uncertainty. Some of you have been reaching out to me and asking, now what? So I wanted to share just a little bit of what we know about the implementation of this one big bad bill so that you have some awareness about what's going to happen. Right now, the home energy efficiency tax credits that some of you maybe have been waiting to take advantage of, they expire almost immediately. So we will lose our home energy savings. The used electric vehicle credit, I know many of you have been waiting for an EV to maybe come onto the used car market. That tax credit is going away by the end of this year. There are provisions in here, and I think it's important to realize the Medicaid work requirements. Now, you will hear some of our Republican colleagues say that able-bodied people who can work should work. But what we know is that in states that have not had Medicaid work requirements, that have implemented Medicaid work requirements later, they have not seen a change in the employment rate. That's because we know that here in Michigan, almost everybody who is on Medicaid who is able to work is already working. Medicaid serves some people who are disabled, who are chronically disabled, who serve children. We don't want to see 6-year-olds suddenly having to go to work. What we know is that Medicaid work requirements are prohibitively expensive and will add millions upon millions of dollars to administrative costs to our state. The Medicaid work requirements that Michigan, by the way, our Michigan Democrats, we repealed those in Michigan, and I'm incredibly proud that we did so. The federal government now with this bill requires that Medicaid work requirements be put back into place no later than December 31st of 2026. What that means for everybody on Medicaid is that even if you are working, you better believe that it is going to be significantly harder to fill out paperwork, to make sure that you're checking in. You're going to add more onerous requirements. And what we have all seen is that you put in one letter wrong in your name, and suddenly that kicks you off of Medicaid. We deal with this constantly in our office, whether it's with unemployment or with Medicaid or DHHS. It's going to make it significantly harder. SNAP work requirements can go into effect as early as this year. And SNAP funding changes go into effect in 2028. Now, some of the worst aspects of this bill, the Medicaid funding changes, will not go into effect into 2028. And I tell you that to say that people may not feel the effects immediately. And that's intentional, because we think about when elections happen, and this is a stateside event, so I'm not going to make it political. I'm just going to put that timing out there for all of you to think about. But what we're seeing already happen is that rural hospitals, birthing centers, nursing homes, who have to plan their budgets potentially years in advance, are already sounding the alarm on the fact that they will have to cut staff, they will have to cut services, and many will have to close their doors. So my last call, I see the sign to stop, is that what really moves people, and I'm very grateful to my colleagues in the Senate, we've done everything we can to backfill our budget. Let me be clear, that is a temporary stopgap. The state budget is funded 42% by federal dollars. Those are our tax dollars that we pay to the federal government that we get in return, and we are not receiving them in return with this bill. They are going to billionaires. So my call to action is, please share your personal stories. Please share them with our offices. Please share them with federal offices, because we are going to have to fight moving forward to put back a lot of the work that's been stripped out of this bill, and your stories really matter. Thank you.
We're going to turn things over to the organizations that will be affected by these cuts and with more difficulty are going to have to manage these cuts and help people who are struggling to live independently, get their health care. It's going to be a difficult job for them. So first we'll hear from Lauren Baker.
Disability Network is a center for independent living, serving people with disabilities across 7 counties: Oakland, Macomb, and the 5 counties in the Thumb. Our Oakland County office is located right here in Troy at 15 Mile and John R. There are 15 disability networks located throughout the state of Michigan, and we are a nonprofit agency that is both federally and state funded. At Disability Network, we work every day to ensure that people with disabilities can live, work, and participate fully in their communities. I've brought some flyers that are located in the back if you'd like to learn more about our agency and how we can assist you. Altogether, there's nearly 3 million Michiganders who rely on Medicaid for health insurance, or 1 in 4 state residents, primarily those with lower than average incomes. In Oakland County, about 10% of residents of the total population receive Medicaid. 11.4% of the population are persons with disabilities aged 19 to 65. I'm here today because Medicaid is under threat, and for people with disabilities, that is a threat to independence, health, and even survival. In Michigan, Medicaid is far more than a budget line item. It's a lifeline that covers 1 in 5 adults aged 19 to 64, 2 in 5 children, 3 in 5 nursing home residents, 1 in 6 Medicare beneficiaries, and 3 in 8 working age adults with disabilities. Among those who would be hit the hardest by these cuts are people with disabilities. Nationally, over 10 million children and adults with disabilities depend on Medicaid for services they can't get anywhere else. In Michigan, that includes access to in-home aids, physical, occupational, and speech therapy, transportation to medical appointments, assistive devices like wheelchairs, and transition services for students and young adults who rely on various supports for their independence. At Disability Network Eastern Michigan, we have already begun to see the early ripple effects. Families calling in distress about possible service disruptions, individuals fearful of losing supports that allow them to live with dignity and autonomy, and community partners unsure how to fill the gaps. I want to thank Representative MacDonell for inviting me to be part of this important discussion this evening, and also share gratitude for her role as chair of the Michigan Legislative Disability Caucus. Thank you.
So I'm going to share a little message that I shared with our team on Thursday, and that was one that was meant to be, now is not the time to panic, but now is the time to plan and advocate. And so I just want to thank State Representative MacDonell for putting this together, because it's going to take all of us, providers, public agencies, state reps, state senators, working along with the state to figure this out. Because right now the federal government has set the framework, and we're the ones, and the state legislators are going to be the ones that implement it. So we serve 25,000 Michiganders each year here in Michigan, about 5,000 with intellectual and developmental disabilities, and about 20,000 with behavioral health. So the impacts are going to be pretty tremendous, not just both from the people we serve, but how we're going to be able to serve them. So I'm just going to highlight some areas that you've heard a lot of, but I just want to highlight what impact they're going to have. And so you heard about the redeterminations. So they're shortening the redeterminations from eligibility, and so from 1 year to 6 months. And while we have advocated for exemption for people with disabilities for many years, that they didn't have to go to a re-eligibility and redetermination, however, they're pushing that up. And so the people that we serve, as you know, have unique barriers. They have transportation issues, technology barriers, etc. And this puts them more at risk. And so think about somebody that doesn't have access to Wi-Fi or to the internet, or just at least to public transit. Think about Maria, I'm just using a name, that has a wheelchair, but her public transporter didn't show up on time. She misses her eligibility determination. She loses Medicaid. It's going to be that quick and that hard. So real examples are missed mail, people getting their work cut from their jobs, missed employer signatures, etc. So failure to meet these requirements will not only mean temporary, but they also could be permanent loss of coverage. So working with people with disabilities, people with disabilities will also face new barriers around copays. So we have heard that mental health and substance use and other services may be exempt. We don't know the full impact of those and their ancillary services like PT, OT, speech, and even respite. So being forced to provide a copay on top of that for somebody that doesn't already have the assets is going to put them at risk as well. And really, when people get off and kicked off their Medicaid now, so if they lose Medicaid, there is a 3-month retroactive period. However, that's going to go down to a month. So think about that time that you're advocating and navigating with the state of Michigan to get your benefits implemented or re-implemented. All those medical bills that are coming in, if they're over 30 days, are not going to be covered any longer. They're not going to go back 3 months. So they're really the impact to the HCBS, I should know that by heart, I do, is going to be impacted over the years. So a lot of this won't be realized in 2028, and with the freezing, of the reduced provider taxes, we're going to have less funds here in the state of Michigan. And so while these are not just essential but needed services for individuals, and they're not meant to be targeted, they're often the first to be cut and targeted because they're not deemed, quote, medically necessary, but they are essential for the people we serve so that their quality of life is not only maintained but improved. We do see some impacts to providers. So a lot of providers without the network live on shoestring budgets, and they don't have the cash reserves to withstand big or any small reductions. And the direct care worker shortage will most likely be impacted even more because there will be less funds available. So what this means to people with disabilities, their families, and their loved ones, longer wait times and less access to care. So while, again, people with disabilities are not target, but they will be hit the hardest. I just want to say that again, they will be hit the hardest. Over 100,000 people, it's expected over 100,000 people with disabilities nationwide will lose Medicaid due to it being required to do in-person redeterminations and for their lack of ability to get there. Really cutting, and this is our advocacy point, and firm partnership with our state reps and state senators that they believe this as well. Cutting, I'm just saying that. I haven't talked to them about it, to be honest, but cutting HCBSE will cost the state a lot more money. So if you think about it as, it's not prevention, but every dollar spent will save the state tons of money. You can say every dollar spent will save the state $3 in more dependent care settings emergency room access, emergency room services, and more care that's needed. So, and without that, and when you think about all that uncompensated care that's going to be happening due to people needing more emergency care, all of our health care, everyone's health care is going to go up because the providers in the hospitals are still going to want to get paid. So really, again, the federal law sets the framework, but Michigan determines the details. And so we have some time, but it's a quick window to really advocate and plan for what we want to do. So we are here, and again, I appreciate the partnership with Senator MacDonell and the other colleagues that are here today. And Michigan can really lead the way in protecting, again, not just the essential services. So when you think about what's determined medically necessary for people with disabilities, what's put in the Medicaid manual is one thing. When you speak to people with disabilities, it's another thing. So make sure that it's not just about essential services, it's about needed services as well. Create safeguards. I didn't talk about mental health tonight, but a lot of people are unhealthy in Michigan that qualify for Medicaid that will no longer have that option. So a lot of people will lose their ability to get Medicaid mental health services, and the impact there is quite large. And so create those state safeguards, create those public safety nets. Really look to maximize the federal waivers. I mean, a lot of people, I don't know if there's a lot of constituents and a lot of everybody here that knows the waivers. We can be creative and we can maximize that. There's going to be more regulations put on waivers, especially like 1115B, and which is part of the state demonstration. And CCBHC is an important part of that today. And as that becomes part of the state plan, and because really providing the needed access and the needed services to people with behavioral health needs and disabilities is one of our #1 values and goals that we strive for. And so really impact to that is going to greatly impact the quality of life of our citizens. So, we can lead the way here in Michigan. We certainly can lead the way by meeting federal requirements. But it's going to take all of us, families, advocates, providers, and people with disabilities are counting us, and they're counting on us to do it right. So thank you for your time. Appreciate it.
Well, thank you, everyone. I am finishing a near 40-year career in public education, and I have proudly served at the Berkeley School District and now Royal Oak for the last 8 years as their leader. And Dr. John Tafalski, our incoming superintendent, started on July 1, and I am handing him this wonderful problem to solve. We'll do it together. First, I want to say that public schools are completely funded by state and federal dollars. And our money comes into our district based on the number of students that we have in the previous school year. So the formula for the number of students in Royal Oak last year determines the funding we get this year. We are obligated to a July 1 that passed budget that we owe to our community, we owe to our teachers, and we owe to our students. So this year, the word uncertain, I believe, has been mentioned 5 or 6 times already by previous speakers. We have no budget yet. But I had to present a budget to our board, a member who is here as well, and to our public to say, here's how Royal Oak Schools will serve you, serve your families, and serve your students. We are obligated to free, appropriate public education, FAPE as we call it. We offer education to every student that comes through our doors. We do not turn students down. We don't ask that students with disabilities or students with special needs go to a different school. They belong in our community, and we are there. I started my career in 1986 as a special education teacher. And I did that because it's the population I wanted to serve. And I'm leaving education as a leader, still proudly wanting to serve every one of those students, pre-kindergarten through age 26 in Royal Oak schools. So we have no budget, but I had to present one to my board, and so we did. We made our best guess at what we could do. We do receive federal funding for special education. We are reimbursed for allowable expenses in Medicare. Those come through to us, and those help us provide those specialized services for students and to families of all ages as we do it. And you count on us in the public schools to do that for you, and we will. Close to 85% of our budget is spent on people. It's the educators, the specialists, the therapists, the administrators. We run a business. Our business in our district is $88 million annually. We employ people, we run services, we run payroll, we have food service, we buy products. But we're not going to cut down on copies to balance the budget. We have to cut people if our funding doesn't come in. And that could be the very person that serves your child, your neighbor's child. So I will thank our legislators who are here today, because number one, they always ask us, what can we do? They need to hear from you. They hear from us, and they need to hear from you. And in addition, we have asked them, when you're tackling ideas and laws and things within the budget that impact schools, ask us. So on behalf of the 28 superintendents in Oakland County, I will say, we enjoy being called to the table to ask our opinion and to weigh in on these topics. We serve 5,000 students in Royal Oak, and we're a medium district in Oakland County. That's 10,000 plus parents across just Royal Oak schools alone, relying on us for this certainty. And we need to provide it, because I know what's certain. Those students will come through the door the last week of August, waiting to be educated, whether I have a balanced budget or not. And we'll do our best to do it and not put things at risk in our own community. So when you have things that are turned or deemed illegal, that takes time. That takes a lot of time to figure out in the legislature and through courts and attorney fees. We don't have that time. Our students are coming. So we do rely upon others to do that work for us and figure out if they can legally withhold money. We were told this year, after receiving funds, that the money was going to be taken back in our next allocation. Now luckily, it was not able to be withheld. We did speak up, and we asked for it, and in Royal Oak schools, we were able to get that funding, but not all districts were as fortunate for their full amount. So think about the risk that that puts those students at now. Not just at risk in education, but at risk of receiving the services that they deserve and should have. So our district also supports these same services in private schools, by the way. So every student in Michigan receives services through the public school, whether you attend the public school or not. I had the wonderful opportunity to work with private schools both in Berkeley and Royal Oak to provide the necessary services to their students who attend their school. So all these grants, all of the things that I have within our budget that come through Royal Oak, we also share those with the private schools in our own community as well. Professional development, aid to the students. We send therapists, we send social workers, and we send others to these schools. All students deserve this faith, their free and appropriate public education, but we have got to have a budget with the appropriate funding to do so. Thank you.
Good evening, everyone. My name is Kelly Dabner. I'm here to represent Samaritas today. Thank you so much, Representative McDonell, for hosting this conversation as we all work together to have the courage that we need to in this moment to respond appropriately to these cuts. I will briefly talk a bit about Samaritas, but then focus really on our behavioral health services that we have here throughout the state. Samaritas has been serving the entire state of Michigan for the last 91 years. We serve about 38,000 people every single year, and we do so in a variety of ways through foster care and adoption, youth aging out of foster care, families in crisis. We welcome legal refugees to our communities and help them to become contributing members of our community. We have 16 affordable living communities across the state of Michigan, focusing heavily on housing and providing housing solutions. And we work closely with those living with addiction and mental health issues in our community. And that's where I really want to focus today. So, let me be clear that these Medicaid cuts and discretionary human service programs are not just budgetary decisions, they're life and death decisions for the people that are in our care at Samaritas. We provide addiction treatment and mental health care for thousands across the state. And these are evidence-based, community-centered programs that prevent overdoses, they stabilize families, they get people back to work. And what we're seeing with what happened on Friday is that organizations like ours may be forced to scale down, turn people away, or shut down programs entirely. That's not what we're committed to at Samaritas, but that is something that we have to have the courage yet to overcome and find new ways. This bill may save money on paper, but it shifts costs downstream. We're going to see more people in emergency rooms and in jails and in the foster care system. And that's at a far greater cost to taxpayers than what we're looking at if it was properly funded with devastating human impact. Discretionary doesn't mean unnecessary. These are trauma-informed, recovery-oriented programs that heal, employ, and empower. We see it every day. And stripping them down dismantles the very systems that make our communities safer, healthier, and more equitable. Are you telling me this word? Hey, okay, all right. So if we gut Medicaid-funded mental health programs and addiction services, we're not just losing programs, we're losing second chances, workforce readiness, and lives. We should be rewarding programs that move people off of public support and into work, and that's what we do every day. When Medicaid supports addiction treatment and mental health, people get jobs, they pay taxes, and become contributing citizens in meaningful ways. And this isn't just about giving handouts, like so often is discussed publicly. It's about restoring responsibility. And these services are the bridge between crisis and stability. And one short example I want to provide for you all is the story of Christina in our care, who would be impacted by these cuts. She was married and in an abusive relationship, an abusive marriage. She had surgery after surgery and described herself as a bionic woman at the end of it because it was so bad. She ended up getting a divorce. She turned to substances to deal with her life. Her daughter was hit by a car by her teacher on accident in the school parking lot and ended up having to have brain surgery. She was then addicted to opioids. She overdosed, and Christina found her dead in her bedroom. And so this cycle continued for her. She came into Samaritas' care. We helped her find the road to recovery. She has gainful employment. She has sustainable housing, and that would not have been possible. This will not be possible if these cuts continue the way we're expecting them to. Those are the differences that we're making and relying on every day to make our community stronger and our families healthy. So, you know, I say as a solution is to band together, be strong, be courageous. I've seen you all out here on the No Kings protest, walking the streets and lifting up your voices, and we must do so collectively and not stand for what we're experiencing. Thank you.
MALA is a leader in advocacy, education, and resources for providers of residential, assisted living, and other community-based services. We are a non-profit association with member organizations serving over 30,000 people across the state, including older adults and individuals with intellectual and developmental disabilities, mental illness, substance use disorders, brain injuries, and physical disabilities. Tonight I'm going to talk a little bit about our provider membership, those who deliver the critical residential and community-based services to people with disabilities. Those services are primarily funded through Medicaid. I'm going to talk a little bit about why this matters. Medicaid is a public insurance program that helps people with low incomes and disabilities access essential care, support, and services. It supports people who have very complex needs, many of whom require 24 hours a day care, 7 days a week, every day of the year. Medicaid funds such services as personal care, which may include bathing, dressing, eating, assistance with using the toilet, and taking medication. It also supports transportation to help people get around. It also supports people with skill building, activities like grocery shopping, managing money, and preparing meals. It's support, it pays for support that helps people live independently as possible in their communities instead of institutions. Most of the direct service needs are provided by nonprofit service providers, like our association membership. They usually work under contract with a community mental health system. These organizations, again, are nonprofit. They're mission-driven organizations. If there are favorable revenues exceeding expenses, they reinvest back into improving services and supporting the staff who provide those services. Member provider organizations employ thousands and thousands of direct care workers. as you mentioned earlier, the frontline or essential workers. Again, those are the folks that deliver hands-on care 24 hours a day, 7 days a week, every day of the year. Here's why we're concerned. Unfortunately, our behavioral health system is severely underfunded. Funding hasn't kept pace with the growing needs of individuals with disabilities. Right now, direct care workers who are essential in the provision of direct care support and services have an average starting wage of $16.06 per hour. Many direct care workers work multiple jobs to make ends meet. Many leave the field for better paying positions, such as fast food and retail. This has created a direct care staffing crisis. Michigan has a 39% turnover in direct care. 87% of our association members providing behavioral health services have had to turn down new referrals due to a lack of staff, and 16% have discontinued programs in the past few months. This means real consequences for you, for me, our neighbors, and our families. Vulnerable people may remain in hospitals unnecessary for weeks or months. Families are forced to be caregivers without support, and people with disabilities lose independence that they once had. Our association is currently evaluating the impact of the Medicaid cuts in Michigan. Even if most funding reductions do not directly impact home and community-based services, the behavioral health system is facing immense pressure, which makes it harder for providers to deliver care. Medicaid is the foundation of care for thousands of Michiganders. Preserving it means protecting our most vulnerable citizens. Thank you. What we understand right now, and Brent, if you know more, please jump in here. It does not appear that there will be direct impact on home and community-based services, and many employment services could fall under the home and community-based services. With that, other areas will be impacted, and as a result, it's likely that home and community-based services will be indirectly and adversely impacted. When resources become scarce, they become scarce.
I'm not sure who this will, I'll let you guys fight for it. How, if at all, will the children's Medicaid waiver be impacted? How will it impact CLS? Respite hours that are encompassed in a waiver program.
You know, while there's a lot of unknowns, I mean, there's nothing targeting specifically. Some of the waiver oversight will be more stringent moving forward. How that directly impacts the children's waiver, I don't know, but I do like the 1115B, there were some certain things written, which is around demonstrations, that the federal government is going to be stricter on approving in the future. How it impacts directly, I mean, I don't think they're going to come out and why the disability services are not directly targeted. It's really, if you look at it, it's all the administrative burden and red tape that is being added to Medicaid that is going to be the difficult part. So they're not going to come out and say we're directly cutting this service, but they will impact the recipients and Medicaid enrollees that are eligible for the future. So I mean, I really think there's a lot of advocacy that's going on there. In fact, the state of Michigan did their analysis initially and said that they were going to have to find 75 to 100 million just to, for lack of a better word, police that workforce requirement. So they have to find, you know, another $75, $100 million just to find ways to monitor if people are working so that they maintain their eligibility. So I think that is going to be really where the fight and the advocacy will be, is supporting people with disabilities to maintain their benefit, to help maintain those revenues, while the state, you know, has to find a huge funding gap, because the funding gap will happen. It won't happen this year, it won't happen next year, but in 2028 it will happen. That'll start to get more and more over the time. So the legislature, along with the state, is going to have to find ways to fill those gaps. And so really what we're seeing is no direct target today, but really the direct target is really on Medicaid and the administrative burden that's going to be placed on not only people served, but providers and states to figure out how to manage people and to make sure that they maintain their benefits.
How will the Medicaid cuts impact reimbursements to public schools for services such as speech, occupational and physical therapies, etc.?
Services to children are determined by their individualized education plan. So that committee comes together and develops a plan for a child. So whether we get reimbursed for the services or not, the district's just still obligated to provide those services to students. Which just means in turn, I have to find somewhere else, our superintendents have to find somewhere else in the budget to take the money from to give the children what they need. So we will support and we will give our services as much as we can to all students as prescribed their need. And I will say too that while schools are the hub of every community, and we know that, they're a vital part of every one of your communities, whether you're in Oakland County or not. But when you do that, you also rely upon many of the other organizations you see represented up here. We rely on YMCAs and the Metro Detroit Youth Club, Boys and Girls Clubs. We rely on all types of organizations to support our entire community and the needs of our families. And so when those the funds to them are also cut, that also then cuts funds and services and supports in turn for the districts. And so we all kind of lose when these things are withheld from being funded for us. Our Medicaid reimbursement is something that we do, as I've said before. These are appropriate things that we are receiving federal funding for and we're reimbursed for, but we're obligated to the services of the students and to provide those, as prescribed in our public schools, and we'll do that. Well, we will and we're look.
It's a really great question and one that I think we've been thinking about. And I guess there's a couple different ways to answer that question, right? And so, one, I started to mention this as I was running out of time earlier, but in the Michigan Senate budget that we passed in May, that was long before the big terrible bill was headed toward the finish line. We were already contemplating some of the impacts of federal actions, and so I mentioned earlier grants for food banks, grants for nonprofits that are providing really important services, grants for small businesses and others that are impacted by the tariffs, etc. I think that the fact is that Senator McMorrow, I think, mentioned this earlier, I think it was you, is that there is no way that the state can fully backfill the Medicaid cuts. There just is not enough money with the current budget that we have. I think, though, that what I hope that as a community that we can start to move toward is thinking about what is the revenue that we actually need to be able to serve all of our residents. Even prior to the one big terrible bill, there are, you mentioned earlier, that our behavioral health system has been underfunded. That's not a new thing. Mm-hmm. And so, I think that one of the things that we really need to take a tough look at is what are the types of revenue that our state legislature would be willing to go for, that the public would support. We just have to, because we should not cut our way to funding what a certain party thinks is a priority or what a certain stakeholder believes is a priority. We actually really need to talk about, and I think that one of our friends here was passing out the Invest in My Kids ballot initiative, which I'm fully supportive of, and I'm hopeful that that will be successful. That is something that would be hugely helpful if we can actually basically create this wealth tax to actually support our education budget. And if we can fully support our education budget, then what other things could we fully support, or at least get closer to fully supporting in other parts of our budget by freeing up some of that money? So that's not a direct answer. I apologize, because there is no one easy direct answer to this question. I think that what is likely inevitable if we actually do ever pass a budget that is negotiated and agreed upon is that there likely will have to be some cuts. But I think for us, it's thinking about, well, what are the things that are most important to you all to make sure that we don't cut those things? Because there are all types of things that we fund in our budget, including well, I won't go through the list. There's a lot of things that we fund in our budget that maybe are less important than making sure that people have food and health care and a safe place to live, right? So getting down to really what the essentials are and recognizing that across our state that we have to think about funding in an equitable way. We cannot we need to make sure that as we're budgeting, that we are thinking about what those basic needs are and that we're not going to leave people behind. So hopefully that's at least somewhat helpful.
I think Senator McMorrow has something else.
Yeah, I just want to put a fine point on that to illustrate it. So when I took over, I'm currently the chair of the State Senate Economic and Community Development Committee. And in my first hearing in my committee, we brought in somebody from Treasury who brought out a chart that showed that the state of Michigan has been operating with the same revenue. So revenue is the tax dollars that we bring in. We've been operating since the same revenue, adjusted for inflation, since 1968. Wow. Yeah. Despite gaining more than 3 million residents between 1968 and today. So if we were able to cut our way to prosperity, we would have been able to do that right now. And I hear from a lot of residents who say, I am already getting taxed too much, my property taxes are too high, and that is very well and true. And I just want to, again, fine point on what this federal bill does. It claims to be looking for waste, fraud, and abuse. There was an employee interviewed, a DOGE employee who was interviewed, and he said, you know, I was shocked when I went through the federal government to find out how little waste, fraud, and abuse there actually was. This bill is not going to return your federal tax dollars to you. It is going to cut all of these things that we talked about just to give another tax break to the wealthiest 10% of Americans. If you make more than $500,000, you are going to get back something like $50,000 in a tax break. The average Michigander today, the average salary is $39,800. So yes, we are going to have to find in the state legislature, if this happens, your federal taxes are still going to be the same. And we're going to have difficult conversations in the state level because we cannot backfill the budget to figure out how we pay for all of these things. But I just wanted to sort of set that as an example because I know we talk about taxes and revenue in abstract. We've been trying to cut our way to prosperity for decades. And now with this budget, we're going to be in an even deeper hole.
Last term, in Michigan, many of you know we have a flat income tax that's required by our Constitution. We don't have that federally, right? We pay a graduated tax. If you're in the highest bracket of income earners, you pay higher percentage federally. Most states have a graduated income tax. In Michigan, we don't and we can't. We all pay the same rate of our salary, whether we make $20,000 or $500,000 per year. It's incredibly inequitable. Because of our flat tax system for income and the fact that we rely so heavily on property taxes and sales taxes, it means that the lowest quintile, the earners that make the least, pay a much higher percentage of their income in their total taxes. It's really unfair, it's really harmful. So when we're talking about raising revenue, we can, through probably not legislatively, we haven't been able to pull that off with a supermajority to get something on a ballot, but there are other ways to get things on a ballot. We can change our Constitution, change our tax structure to allow for a more equitable way of generating revenue, getting taxes. So I have the brackets in my office for a graduated income tax that would raise taxes on people who make $520,000 per year. It would generate over $1 billion, and it would only raise taxes for people who make more than $520,000 per year. If you make less, $519,000 or less, like most of us do per year, your taxes would either stay the same or go down, and it would generate $1 billion of revenue. So this is possible to do in a more equitable, fair way without creating more harm on the people in Michigan who need the most support.
Almost all children in foster care are on Medicaid, right? So this would impact access to health and mental health services for nearly all children in foster care across the state. So it would be a pretty significant impact everywhere across the system, in addition to what we don't know yet.
Yeah. And just to add on to that, I mean, I do think a lot of it, the federal government, I mean, certainly doesn't want to come out and say that they are reducing Medicaid or reducing services. But as you can see, that there is a theme going on where it's really reducing those who can qualify to be enrolled, or the administrative burdens and the administrative red tape that's being put on the state to keep people enrolled is going to be difficult. And so that's our, initial, there's still a lot to figure out with the bill, but that's our initial feedback on it.
Prescription drug costs for people on Medicaid, because Medicaid pay for prescription drugs.
Yes.
So it's just going to be another
Yes.
area where that's going to be a problem. Awesome.
And we don't know about co-pays or anything else with that either, so co-pays, I'm sure we'll get into that.
It is an 800-page document, is my understanding, with a big bill.
But we have legislation to create a prescription drug affordability board.
Sure do.
We do, we do. There is an army of people out here who cares. Please help us. We need your help, we need your scores, we need you to push us. Please push those people in the Oxford townships and places where we're trying to reach as well. Thank you all for what you do. Please keep going.